Hola a todos y bienvenidos a esta nueva serie de pláticas con líderes en salud global. Nosotros somos Luis Martínez y Julieta Lomelín y estamos en esta ocasión platicando con el profesor Sir Andrew Haines, quien es uno de los mayores exponentes en el tema de cambio climático y sus efectos para el planeta y para la salud de las personas. El profesor Haines es un médico epidemiólogo e investigador británico con una gran trayectoria en salud pública. Ha participado en diversos comités nacionales e internacionales, como el Medical Research Council del Reino Unido, en donde él fue presidente, y como miembro asesor en investigación en salud de la Organización Mundial de la Salud. Desde 1991, su investigación se ha centrado en el estudio de los efectos del cambio ambiental en la salud y el impacto de las políticas para adaptarse o mitigar estos cambios. En el 2014 y en el 2015 fue presidente de la Comisión de Lancet y de la Fundación Rockefeller sobre Salud Planetaria y copresidente de la Red de Acciones y Conocimientos en Salud y el Futuro de la Tierra. En este momento, el Dr. Haines es profesor de Salud Global y de Cambio Ambiental y Salud Pública en la Escuela de Higiene y Medicina Tropical de Londres, donde además es miembro asesor del Centro de Estudios sobre Cambio Climático y Salud Planetaria. Professor, hi, how are you today?
Very well, thank you. Muchísimas gracias por la oportunidad de hablar sobre el tema del cambio climático.
Oh, fantastic. Thank you so much for your time and for giving us some minutes to talk about planetary health and climate change. Professor, but first, can you tell us a little about yourself? Who is Sir Andrew Haines?
Okay, well, my background is not a medical one at all. I was the first person in my family actually to go to university. And interestingly enough, I was inspired by my own family doctor, who was a female doctor. She worked alone, and she made a big impact on me as a child. And she really influenced me, my choice as medicine, my career in medicine. And following my graduation, I worked in clinical medicine for many years, but I also combined my clinical practice in primary care, largely, with work in epidemiology and public health. So my career, at least the first part of my career, was very much about combining both the population perspective with the more individual perspective of clinical medicine. Subsequently, after I moved to the London School of Hygiene and Tropical Medicine, I spent 10 years there as director, as Peter Piot's predecessor. And I developed this interest in climate change and health, environmental health more generally, over the last few decades. And as director, I was able to carry that forward, working with colleagues at the London School. Since stepping down as director, I've really focused on this whole area of environmental change and health, as you said in your introduction, with a particular focus on climate change and health, but it's not the only work we do. We also work on other broad environmental issues, including this concept of planetary health that you outlined, which is essentially the health of human civilization and the health of natural systems, how the two are dependent on each other.
Well, that's really an interesting concept, an important concept for these days. But, how did you define, how should we define planetary health, and why this concept is so important in general and in particular for human health?
Well, first of all, a few words of background, because I think it's important that listeners understand that we're in a very completely new era in the sense of human history.
Yes.
Because when humanity developed, called the Holocene epoch, which lasted 11,500 years or so, and that was the period in history and prehistory during which humanity grew from being hunter-gatherers, agriculturalists, and now, of course, into largely urban dwelling populations. What we've seen is, of course, dramatic advances in human health, human progress, particularly in the last couple of hundred years or so. But those advances have come at a cost, and the cost has been borne by natural systems. So now we're seeing dramatic changes in the world's environment. We're seeing increases in temperature, global average temperature going up by 1 degree. We're seeing dramatic declines in biodiversity. So we're losing species maybe at 100 or perhaps 1,000 times greater than the pre-human times. And many other environmental changes are occurring. So against that background, the Lancet Commission that I chaired developed this definition of planetary health, which was we defined very, very simply as the health of human civilization and the state of the natural systems on which our health as humans ultimately depends. So we are undermining these natural systems. It's our species and the growth in our species and our consumer society that's undermining the integrity of these natural systems. And that is and will have increasing impacts on our health.
Thank you so much, Professor. You also talked in your lectures about two concepts, the Great Acceleration and the socioeconomic and health system trends. Can you tell us more about these two concepts?
So the Great Acceleration is a term which has been coined originally not by me, but by other researchers. And these mainly were environmental researchers looking at the transformation of the global environment. And the Great Acceleration is the acceleration both in terms of human development, and so scientists debate as to actually when that started, but certainly around the middle of the last century, we saw a dramatic acceleration in terms of socioeconomic activities. Obviously, life expectancy was improving before that, but it continued improving after that. And there was dramatic economic growth, although very inequitable economic growth. So there was an acceleration of human activities, but also an acceleration of the impacts of those activities on the global environment. And the group led by people like Johan Rockstrom and Will Steffen coined this idea of planetary boundaries. So the planetary boundaries were these finite boundaries within which humanity can thrive, can live comfortably. And those boundaries include climatic boundaries, also probably biodiversity boundaries, atmospheric boundaries of various kinds. And we have to try to live within these boundaries if we're going to have a stable environment for the future. And of course, at the moment, we're exceeding some of those boundaries or we're coming up against them. And so we really have to act very quickly if we're going to be able to sustain human society within these finite boundaries that humanity has historically developed within. And then you mentioned the other concept. I'm sorry, I didn't exactly hear your question.
Yes, we were talking about...
The other concept is about socioeconomic and health system trends.
The correlation.
Socioeconomic and health system trends. Well, I think I've partly dealt with those in my... I mean, in terms of health systems, of course, we've seen a big improvement in healthcare. We know that we still haven't achieved universal health coverage, and indeed that's obviously the focus of Sustainable Development Goal number 3. But the challenge is not just to improve healthcare, but also to do so at a much lower environmental footprint than we have at the current. We know that the health systems themselves create quite a lot of greenhouse gas emissions, probably about 5% of the total, more than that in some countries. But they also have large environmental footprints in terms of the chemicals they use, for example. And so we need to look at the environmental footprint of the health system, but also to increase the resilience of the health system. And when I say resilience, I mean the health system needs to become more able to deal with environmental shocks. Environmental shocks are going to come increasingly intensely, but also increasingly frequently as climate change and other environmental changes gather speed over coming decades, unfortunately.
I think that's really, really interesting and something that we have to not only think about, but take action. And another question would be, what do you think are the most important health challenges that we will face due to climate change?
So climate change is going to have a range of impacts on health, and indeed those impacts are already happening. The most obvious ones are the direct effects of increasing heat, for example. So heat waves, or many deaths occur outside formal heat waves. The effect of increasing heat on labor. So, in Mexico, of course, you'll be very familiar with the fact that in tropical, subtropical regions, extremely difficult to work, to undertake heavy work, particularly during the summer months, because it's very physiologically stressful to the human body, and also is hazardous if you continue working in extremely hot circumstances. So we know that labor productivity is already declining as a result of climate change and will decline further in the future. But then beyond these very direct and obvious effects, there are also indirect effects, and these can occur through different mechanisms. One of these is through increase in the transmission of infectious diseases. So, for example, vector-borne diseases such as dengue would be the most obvious one, which we know is spreading around the world, not just due to climate change, but there's other factors involved as well. But also water-related diseases would be another example of the kind of disease, infectious diseases that are increasing that will increase mostly as a result of climate change. Of course, it's not just climate change, there are other changes occurring as well. Land use changes are bringing humans in contact with animals, and there could be then zoonotic disease outbreaks and so on. And then the other category of ill health, of course, is these socio-economically driven effects. So increases in poverty, for example, because people can't work outdoors as much, or crop yields decline. Changes in nutrition because of decreasing agricultural yields, crop yields declining. And then, of course, increased risk of population displacement, migration, and probably conflict. The latter ones are difficult to quantify. I think they happen. I think they will happen, but of course they're still a bit controversial and still difficult to give precise estimates of. So these are examples of some of the impacts that we're likely to be seeing increasingly over future decades.
Yes. Well, we know that since 1991, you and your college have been advocating for public health policies precisely to reduce greenhouse gas emissions as a way to obtain better health outcomes for the population. And now, well, 11 years after your Lancet series publications, what are the changes that you have seen in policymakers, in academia, and the general public around this topic? Is this an eclectic concept, or?
Yeah, thank you. I mean, yes, as you say, our 2009 Lancet series on the public health benefits of the low carbon economy, on what we call climate change mitigation, in other words, reducing the combustion of fossil fuels and other policies which reduce greenhouse gas emissions in sectors like transport, for example, increasing active travel or low carbon transport, much more energy efficient housing in the food and agricultural sector. So we know that some dietary choices are accompanied by high greenhouse gas emissions, particularly those that involve consumption of products from ruminant animals, because ruminants produce methane, which is a powerful greenhouse gas. So we've been arguing, as you say, for many years for policies which will both reduce greenhouse gas emissions and improve health. So they're often called the co-benefits, the health co-benefits of greenhouse gas emission reductions. And so some of the examples would be policies to decarbonize our energy supply, for example. So we know that fossil fuel burning, fossil fuel combustion, also, as well as it causing lots of greenhouse gases like carbon dioxide, also causes lots of air pollutants like the fine particles, which are so damaging for our lungs and for general health. And recent work that we've done suggests that fossil fuel burning is responsible for about 3.5 million deaths, premature deaths a year worldwide as a result of air pollution. So over and above the climate change issue as a result of air pollution. So if we could decarbonize the world's energy supply, then obviously that would produce near-term benefits to health as well as reducing risks of climate change. So have we seen much progress? Well, I think we've certainly seen scientific progress. We've got quantification of the health benefits from these different policies. There's increasing work in areas like sustainable diets, for example, trying to optimize diets to reduce the environmental impacts, but also improve health. Got more evidence on sustainable cities, urban policies, transport and other policies which can reduce greenhouse gas emissions and improve health. And of course, the energy policies that could do so as well. So the evidence base, I think, is much stronger than it was 10 years ago. But there still has been a delay in terms of policy uptake. And I think you're right that it's still not widely appreciated that there are these win-win policies whereby we can reduce the risk of climate change, cut greenhouse gas emissions, and also get health benefits in the near term. And the other point that's important to make is that if we value these health benefits using well-established economic valuation approaches, like valuation of statistical life, for example, then the benefits of air pollution reduction can outweigh some of the costs. The degree to which they do that depends on your background levels of air pollution and background energy supplies and so on. But they can make a substantial contribution to offsetting the cost. And we believe that this kind of positive message can make these decisions more attractive to policymakers and also more attractive to the public. I think it's fair to say that reframing climate change from an environmental problem to a may make it easier and more politically palatable to move forward with the rapid decarbonization of our societies that we need in order to reduce the risks of dangerous climate change.
Okay, yes, totally right. Well, according to what we understand and all the phenomena that we are seeing, it seems that people facing poverty are usually the most affected by climate change. And in that sense, how can we bring the health equity lens into the development and implementation of those policies to tackle climate change and protect the most vulnerable?
Yes, you're absolutely right. I mean, those people who've contributed least to climate change, because we know that poorer populations have lower per capita greenhouse gas emissions, are often the most vulnerable to the effects of climate change. So that's a really powerful challenge, I think, both in terms of the climate justice issues, but also it's quite a challenge to those of us in the public health community. How can we safeguard the health of these vulnerable populations in the face of climate change? And also avoid adding costs to poor populations when we're trying to mitigate climate change. So there are several policies that can be put in place, of course. One is to improve adaptation to climate change, creating more resilient societies. And we can do that in various ways. There are specific adaptation mechanisms, for example, like early warning systems. So heat early warning systems or vector-borne disease outbreak early warning systems, which, if they're properly implemented, can reduce the vulnerability of populations. It's not a question just of issuing the warning. You actually have to have the health system in place that can reach out to the vulnerable populations and make sure that they're safeguarded. We can also put in place policies to improve the quality of housing, for example, for vulnerable populations, people or elderly populations, making sure that housing is more resilient to climate extremes, but also has a lower energy requirements. And then, of course, food. Food is, with climate change affecting crop yields and nutritional quality, there's a real danger that the nutrition of poor people may be disproportionately affected. So policies which increase the access of disadvantaged and poor populations to healthy food are going to be crucial in that respect. And we also need to guard against transferring some of the costs of climate change to poor populations. So let me give you an example of that. In France, before Christmas, towards the end of last year, the French government, President Macron, tried to increase fuel prices. There was a big reaction, a big social reaction to that, because the poor people were disproportionately affected, because the rural poor need their cars because they can't get access to affordable public transport. And that reminds us that when we're trying to put in place policies to reduce fossil fuel combustion, we need to make it really clear that we need to be very careful that we don't disadvantage the poor. There are various ways of doing that. One is by increasing subsidies for clean energy, subsidies for healthy food, so recycling some of the taxes that we get from carbon taxes or other taxes in of subsidies to disadvantaged populations. These are, just some examples that one can think about. So the design of these policies that promote equity is going to be really important in terms of making sure that they have the desired benefits.
Thank you. And finally, Professor, this interview will be watched by young and health professionals, mainly in Mexico and Latin America. So what would be your message that you would like to give to them today?
Well, to them, I would say we are facing very, very major challenges indeed over coming decades. You, as young health professionals, will be grappling with these problems during the course of your professional life. So obviously there are very major concerns ahead, and we do need to act quickly, both to try to adapt to climate and other environmental change, but also, and very importantly, to reduce the impacts of our societies, including our health systems, of the environment. But we shouldn't be paralyzed by fear or by pessimism. What's really important is to create and to articulate a positive vision for the future of a society which is healthy, but also much more sustainable than our society today. And I think you, as young health professionals, have a tremendous opportunity to articulate and to implement policies which can improve health and improve sustainability for decades to come, and of course for future generations.
Fantastic. Professor, well, thank you for that message, and thank you for all the concepts and the knowledge that you have shared with us today. I just want to thank you for your time one more time, for giving us today this space, and please receive our best wishes and the greetings from all the Mexican Society of Public Health and the Carlos Slim Foundation. And our best wishes also for you, to your family, and all the amazing team at the London School of Hygiene and Tropical Medicine.
Thank you so much for this great opportunity to talk to you and your colleagues. Thank you.
Thank you, Professor. Have a good day.
To you.